healthcare apps. We would have met at least 10 or 15 of them in the last 1 year's time. And most of them sounded very innovative in the concept, but then I am not too sure about how they will be able to come up with the final product. But then the enthusiasm that I see from these young guys to come up with such ideas is brilliant. They are able to have a very clarity on thought process. The only thing which I feel they lack is actually understanding of the businesses. If they come and talk about healthcare, I would seriously think that they should have a better understanding about the processes and procedures that is involved in healthcare, so that they are able to bring in better apps. What we are trying to help them is, in fact, our chairman was very keen. He participated in the Yes campaign, Yes meeting last time, and he has picked up a few apps basically to be looked at across our group. So we are trying to pitch for them and also maybe get into a sort of funding for them. So there is some activity happening there, and today's event was like you see a lot of people with different experiences coming and talking to them. Actually, they would be able to pick up the right cues from that and maybe work better on that. The group is like pretty senior guys who could come and talk about a lot of things which all of them have experience. I would say the group was like 15-20 years of experience in each of their respective fields. Will be able to support these guys in a much better way, and they will all be doing quite well, I should think. See, most of these people, including a lot of people we worked, have come up in from a small way to a larger way, so that's always a way of reciprocating. The second thing is, if you go with an established player, the kind of support they could give us is predefined. See, the flexibility part of it is missing in that. They will say, this is what I have to offer, whether we adopt ourselves to them, which I don't think is the right way to look at it. Because for a startup, they are very flexible, because they need a lot of things to happen, because they are at the beginning stage of the processes. So there is always the flexibility part there, if you want to add, delete from what they are offering. And more often than not, these people are able to customize, which a standard player will find it very difficult to do it. No, see, when you talk about technology, India is way too ahead of any of the countries that we operate in. GCC, I would say, is a bit behind in terms of all the technologies we talk about. Most of the technologies we use there, the generation or the origins are from India, which goes into that. I haven't really seen them coming up with a big time idea, or if at all somebody is coming up there, more often than not, they are an Indian company based out of there who is making those things. I think infrastructure wise they may be extremely dominant, but then I don't think on the intellectual part of it, especially in creating these kind of IT related or kind of stuff, I don't think they have still reached there. So it's more dependent upon the Indian or the other countries, developed countries, which do that. One is that they should understand the people whom they come and pitch actually need that product. One, very clearly, that is what it. Second is their understanding about the businesses, because they should know in and out and in-depth understanding about the kind of businesses people are in. And the third is there has to be a utility value to this. If a patient wants to use this, a patient should find that there is something which makes him use this. If you come up with an app which is too complicated, people will rather say that I would rather make a phone call, get my appointment, rather than trying to use a app which takes more time than getting my appointment through a call. So the convenience, the usage convenience is one of the major factors there. And then I feel that they should understand the business, and the app has to have relevance to the business what they talk about. Basically Aster Medcity is part of Aster DM Healthcare, which is headed by Dr. Azad Mopen. See, we today have one of the largest areas, in terms of the availability in terms of beds or in terms of specialities. Aster Medcity is one of the largest player in the current scenario, and the focus for us is clearly the local market, plus a lot of international patients will look at such a facility, and we have our marketing team spread across today GCC and some of the African countries. We plan to stretch ourselves into the other parts of the world, and by the current standards, we are talking about 20 to 25% of the revenues being generated from medical value travel, which is the in thing. And we have been supporting there is a Kerala Health Mart happening 2 weeks back, and we were one of the major supporters in that, where Kerala is trying to, that's the good part, is it's not individual hospitals who are going to try and market Kerala. It's the whole hospital group coming together, and with the support of the Health Secretary and the Tourism Secretary, we are going to pitch for Kerala rather than trying to pitch for Aster Medcity or for Amrita separately. So we are coming together as a hospitals together as a major entity. And then what we are also looking at is, and that is the quality part of it. Because today, if you want international patients to come in, your accreditations are quite a requirement, like JCI, NABH, and we are the first one in Kerala to have the JCI accreditation, which we got in less than 1 year's time. So quality will play a major part when international people want to come. And the benefit we have is we have got hospitals spread across Kerala. At least Cochin and up north we have hospitals. So we can provide them multiple options today, which many of the other people are not able to do today.